Hi guys. So in today's video, let us learn about the homeopathic therapeutics of cholelithiasis. So what is cholelithiasis? It is the presence of stones in the bile ducts. Females who are fat, fertile and in the 40s are disposed to get cholelithiasis. So basically there are two types of gallstones, the pure variety and the mixed variety. The pure variety is again classified based on what they are majorly made up of. It can be cholesterol stones, pigment stones and calcium carbonate stones. So, gallstones become symptomatic only when obstruction becomes significant enough. And once it becomes symptomatic, the patient presents with the following symptoms like pain in the right hypochondrium and epigastrium, which can be radiating to the shoulder. And there can be nausea and vomiting. There can be steatoria, that is the clay colored stool, due to presence of undigested fat. Dark urine because of bilirubin in urine. And there can be jaundice in severe cases and fever if the patient is infected. So now let's learn 5 remedies that are homeopathically indicated for cholelithiasis. The remedies that I have taken is Chelidonium, Berberis vulgaris, Cardus marianus, Lycopodium and Calcarea carp. So when we learn its therapeutics, we have to note down how the clinical symptoms of cholelithiasis is characterized in each of the remedy. So first let us see Chelidonium majus. And when we study any remedy, first we have to learn its generalities, because these symptoms will be present in all the cases that remedy is indicated in, irrespective of the clinical condition. So in Chelidonium, the generalities are yellow coated tongue with imprint of teeth, and there can be this bitter taste in mouth. They also have a marked desire for hot drinks, which is mentioned as boiling hot drink. And it is right-sided predominantly, and in Allen's keynote it is mentioned to have icy coldness of the right foot objectively. And the general modalities are amelioration of the symptoms after dinner, and there can be aggravation in the early morning and by motion and touch. And going to the characteristics of Chelidonium, in boric it is mentioned to be indicated for the biliary affections in pregnant women. And their abdominal pain is characterized by the constant pain in the lower and inner angle of the right scapula. So here the abdominal pain of cholelithiasis in Chelidonium is characterized with the pain in the inner and lower angle of the right scapula, which can be better temporarily by eating. And there is this nauseating feeling and vomiting, which is relieved by drinking very hot drinks. And here there is this constipation which presents as sheep's dung like stool, and which alternates with diarrhea. And here the urine is said to be like beer due to its foaminess. Now let's go to the next remedy, which is Berberis vulgaris. So the main general symptom of this remedy is the alternation in the type and location of the symptoms. And pathophysiologically, they promote the biliary and hepatic functions. And generally all pain is worse on standing and active exercise in Berberis vulgaris. Okay, so about the characteristic symptoms of Berberis vulgaris, here the patient presents with right hypochondriac pain which radiates to the left scapula. And here to remember that, we can remember that Berberis vulgaris is indicated for left-sided renal colic. So here the gallstone colic is radiating to the left scapula. Okay, so now here the pain is like the bubbles coming through the skin. So the pain is of a bubbling sensation. And Berberis vulgaris is indicated for gallstone colic presenting with jaundice. Now moving on to the next remedy, that is Cardus marianus. This remedy is indicated for the acute exacerbations of cholelithiasis when the patient presents with terrible pain and hepatomegaly with tenderness. Here the hepatomegaly is in the transverse direction, and whereas in chelidonium it is in the vertical direction. This is mentioned in Clark's dictionary. And here the pain is worse on inspiration and on bending down. And in Cardus the urine is cloudy, whereas we saw in chelidonium the urine is frothy. And here it is also mainly indicated for the patients who come with history of excessive alcoholism, especially after drinking beer. Now let's move on to the next remedy, which is lycopodium. Here the marked generalities are aggravation of all the symptoms from 4 pm to 8 pm. The time modality of lycopodium is very important, and the patient presents with desire for sweets. So unlike in chelidonium patients, where patient wants very hot drinks and feels better with that, here in lycopodium the patients prefer warm drink and food. So, and they also feel full on eating very little food. That is also a concomitant symptom in lycopodium, that is easy satiety. And looking into the characteristics, here we can see that the pain shifts from the right hypochondrium to the left side, and patient also presents with concomitant symptoms of right shoulder and arm pain along with the right hypochondriac pain. So here, and the patient presents the flatulent distension of the lower abdomen. This particular symptom can be seen as a concomitant along with the many other clinical conditions where lycopodium is indicated. Now moving on to the next remedy, that is calcarea carb. So the marked generalities here are excessive sweating, especially of scalp, which is of the sour order, which is mentioned as wets the pillow. That is, the excessive sweating of the scalp of a calcarea carb patient can be seen as the pillow soaked with sweat. And here the patient presents with excessive craving for egg and indigestible things. Here also we can see that, like in lycopodium, calcarea carb pain, gallstone colic shifts from right side to the left side, and here patient cannot tolerate any tight outfit around the abdomen. So this is also a peculiar symptom where the patient cannot bear any tight dressing around the abdomen. And here the gallstone colic is ameliorated by lying on the painful side. So since the gallstone colic is in the right hypochondrium, here the patient feels better lying on the right side. And here the concomitant is chilliness during the pain. This is mentioned in Clark's dictionary. And the constipation of calcarea carb is characterized in such a way that the first part of the stool is hard and the subsequent parts are pasty and then liquid. So these are the 5 main remedies homeopathically indicated for cholelithiasis. I hope you guys have benefited from this video. Thank you.